If you've ever looked at an ABG and wanted to cry, this is for you. I failed my first ABG quiz. Twice. My instructor said I'd never get it. But here's the thing, ABGs aren't hard. They're just taught wrong. So I'm going to teach you a method so simple, you'll never forget it. Most nursing students memorize charts, ranges, and formulas. Then they get to clinicals and freeze. Because memorizing isn't understanding. You need a system. And I'm about to give you one that takes 30 seconds to use every single time. Here's what we're doing in the next 6 minutes. First, I'll show you the only 4 numbers you need to look at. Second, I'll teach you TICCO, the fastest method to interpret any ABG. Third, we'll practice on a real example, step by step. By the end of this, you'll be faster at ABGs than half the nurses on your unit. Let's go. Okay. Step 1. Stop looking at the whole ABG panel like it's a puzzle. You only need 4 numbers. 1. pH. Is it acidic or alkaline? Normal is 7.35 to 7.45. Below? Acidosis. Above? Alkalosis. Write that down. 2. PaCO2. That's your respiratory system. Normal is 35 to 45. High CO2 means they're retaining acid, respiratory acidosis. Low CO2? They're blowing it off, respiratory alkalosis. 3. HCO3. That's bicarb. Your metabolic guy. Normal is 22 to 26. High? Metabolic alkalosis. Low? Metabolic acidosis. 4. PaO2. This just tells you oxygenation. We'll come back to this, but it's not part of acid-base interpretation. 4 numbers. That's it. If you know what's normal, you're already halfway there. Now here's the method that changed my life in nursing school. It's called TICCO. I'm going to break it down. Check the pH first. Is it trouble? If pH is low, you've got acidosis. If it's high, you've got alkalosis. Circle it. This tells you the problem. Identify the cause. Is it respiratory or metabolic? Look at your CO2. Is it going the opposite direction of the pH? Then it's respiratory. Here's what I mean. pH is low, CO2 is high. Respiratory acidosis. The CO2 is causing the problem. pH is high, CO2 is low. Respiratory alkalosis. If CO2 is normal or going the same way as pH, it's metabolic. Check your bicarb instead. C. Check for compensation. This is where students get lost, but stay with me. Your body doesn't like being acidotic or alkalotic, so it tries to fix it. If the problem is respiratory, the kidneys compensate by adjusting bicarb. If the problem is metabolic, the lungs compensate by adjusting CO2. Full compensation, pH is back to normal. Partial compensation, pH is still off, but the other system is trying. No compensation, only one value is abnormal. C. Check your CO2 again. Did we identify it right? Is it the problem or the fix? O. Oxygenation. Is the PaO2 normal, 80 to 100? If it's low, they need oxygen. Simple. TICCO. Write it down. Use it every single time. Let's do this for real. Here's your patient. They come in with shortness of breath. Here's the ABG. pH, 7.28. PaCO2, 58. HCO3, 26. PaO2, 68. Step 1. T. Trouble? Yeah. pH is 7.28. That's low. So we've got acidosis. Step 2. Identify the cause. Look at CO2. It's 58. That's high. pH is low. CO2 is high. They're going opposite directions. That means respiratory acidosis. The lungs aren't blowing off CO2. Step 3. C. Compensation. Check the bicarb. It's 26. That's smack in the middle of normal. So the kidneys haven't kicked in yet. This is uncompensated respiratory acidosis. Step 4. O. Oxygenation. PaO2 is 68. That's low. They need oxygen, stat. Diagnosis? Uncompensated respiratory acidosis with hypoxemia. What's the cause? Probably COPD, Pneumonia or airway obstruction. What do? Oxygen. Position them upright. Maybe BiPAP. Notify the provider. See how fast that was? TICCO. Every time. Here's what trips people up. Trick 1. Rome. You've probably heard this mnemonic. Respiratory opposite, metabolic equal. If pH and CO2 go opposite directions, it's respiratory. If pH and HCO3 go the same direction, it's metabolic. Use Rome if TICCO feels like too much. Both work. Trick 2. Don't overthink compensation. If pH is normal, but CO2 and bicarb are both abnormal, fully compensated. If pH is abnormal, and both CO2 and bicarb are abnormal, partially compensated. If pH is abnormal and only one is off, uncompensated. That's it. Trick 3. Always think about your patient. A diabetic in DKA? Probably metabolic acidosis. A patient hyperventilating from anxiety? Respiratory alkalosis? COPD patient retaining CO2? Respiratory acidosis. Context is your best friend. All right, pop quiz. Pause the video and try this one. pH, 7.50 Pa CO2, 30 HCO3, 24. What is it? Ready? pH is high, alkalosis. CO2 is low, opposite of pH, so it's respiratory alkalosis. Bicarb is normal, no compensation. Answer: uncompensated respiratory alkalosis, probably caused by hyperventilation, anxiety, or pain. If you got that right, comment "I got it" below. If you didn't, watch this video again. I promise it'll click. ABGs don't have to be scary. You just need the right system. Use TICCO. Practice it 3 times. You'll never forget it. If this helped you, smash that like button and subscribe to Nursing Simplified. We make the hard stuff simple. Drop a comment. What's the hardest part of ABGs for you? I read every single one. And if you want a free ABG cheat sheet, check the description below. Now go ace that exam. You've got this.